Good evening, Bahamas. Coming up tonight.
The Ministry of Health confirms that there are now 4 cases of the Zika virus confirmed in the Bahamas. We have the details straight ahead.
S&M MP Nico Grant announces his political future. That story straight ahead.
The NHI Secretariat announces what officials say is another big milestone in the rollout of national health insurance. That story straight ahead.
1 week after letting go of 600 persons, the Sandals Royal Bahamian Resort hosts a job fair. That's coming up tonight on our news.
Welcome to our news. I'm Christina McNeil. Thanks for joining us. Topping news tonight, nearly 2 weeks after the first confirmed case of Zika in the Bahamas, the Ministry of Health today advised the public that 3 new confirmed cases of the virus have been recorded on New Providence. Health Minister Dr. Perry Gomez says the spread of Zika is now a major concern. Simone Davis tells us more. Simone?
Thanks, Christina. The ministry revealed today that 2 of those 4 persons who contracted the Zika virus were males and 2 were females, all residents of New Providence. Health Minister Dr. Perry Gomez gave an update on the status of those persons infected with Zika.
On the 10th of August, the first case was reported. Since that time, we have received notification of 3 additional cases. All cases sought medical attention after having symptoms suggestive of Zika virus infection. All patients have been treated for associated symptoms and are doing well.
Health officials reported that the areas of top concern are Pinewood and Carmichael. Director of Public Health Pearl McMillan also noted that there have been 83 suspected cases of Zika reported, and of that number, 8 are pregnant women. She added that officials are currently waiting on results from the suspected cases.
Based on our case definition, with the 83 suspect cases, we will then, samples would be taken and sent off to our reference lab. And based on review of what, the history that we would have provided and all of the information that we send out with each sample, then, the lab may or may not test every case. And once they get a confirmed case, of course, they will then send that back to us.
Gomez said the risk of transmitting Zika through sexual intercourse is of greatest concern for pregnant women who can pass the infection to their fetus. He said residents can avoid sexual transmission by using condoms correctly every time or abstinence. As for the confirmed cases on New Providence, Gomez said some of them were local transmissions and the others were travel-related.
Based on the histories received from the cases, it has been determined that there is a mix of travel-associated and local transmission of the virus. The Ministry of Health is intensely monitoring the situation with an active surveillance program within the Department of Public Health.
Cases of Zika have already been reported in Florida, Jamaica, the Cayman Islands, Turks and Caicos Islands, and Canada. According to health officials, the most common symptoms of Zika virus are fever, rash, joint pain, and conjunctivitis. Other symptoms include muscle pain and headache. 80% of people with the virus won't have symptoms or will only have mild symptoms, which may last for several days to a week. The Ministry of Health is advising residents to contact their healthcare provider if they've recently traveled to an area with Zika or are experiencing any symptoms. Reporting for our news, I'm Simone Davis.
Thanks, Simone. We will continue to keep you updated on this developing story. Well, in addition to monitoring Zika cases, the Ministry of Health has teamed up with the Department of Environmental Health Services to begin fogging efforts. Here's Assistant Director Andrew Thompson.
We're using what we call a pyrethrin or pyrethroid-based chemical, which has a fast knockdown, and it's in combination with another chemical. The name escapes me now, and so that is the one that we are using at the moment. And what we have been advised to do by protocol is to use one chemical at a time. And so let's say within the year, then we'll switch to another chemical, and this is to avoid or to reduce the mosquito being resistant to what we are using.
Thompson advised that the chemicals are not harmful to residents. He also noted that fogging is expected to continue during the night for the next few days, especially in the affected areas.
Well, we have done the island, and once we finish that, we go again. But again, the emphasis now is not just the actual coverage, but to work in those areas where we have cases or suspected cases. And what the protocol requires is that we try to get around the case and a quarter mile of the case, either 3 times within 10 days or 5 times within 10 days. And what we are trying to do there is to knock out of the population any infected mosquitoes.
After 24 years in Parliament, Central Grand Bahama MP Nico Grant has announced his plans to move on from frontline politics. Grant's announcement is just the latest fallout from last month's contentious Free National Movement convention. Our Jasmine Brown has the details in this report. Jasmine?
That's right, Christina. Grant announced that he will not be seeking renomination ahead of next year's general election, and he also expressed frustration with the state of the F&M under the leadership of Dr. Hubert Minnis.
I now wish to confirm, or reconfirm, that I will not seek re-election in the upcoming general election.
Grant, who has served as a member of parliament for more than 24 years, recently stepped down as leader of opposition business in the House, citing Minnis' dissatisfaction in his performance. During a news conference on Sunday, Grant said the F&M is in disarray.
The Free National Movement is challenged in more areas than one.
Grant says he has been supportive of Minnis since May 2012, but that support began to erode following the F&M leader's response to controversial comments made by then-Senator Lanisha Roll about her parliamentary colleagues. Grant said he also took offense to Dr. Minnis' failure to deal with yet another F&M member who accused those challenging the party's leader of committing treason.
I have been villainized by some, demonized by others, but it didn't bother me because I knew that I did the best that I could. I also supported the leader, and I have documents. I trust I will not have to produce them to prove where I have done that. But to be dragged in the mud by a senior member of this party is unacceptable.
The former cabinet minister adds that while he is a proud F&M, he cannot say what his role in the F&M will be moving forward.
I have had the privilege, as noted earlier, of winning 5 consecutive elections. I believe I know how and what it takes to win elections. The role I will play is to be determined.
Following Grant's announcement, Dr. Minnis released a statement saying the F&M celebrates Grant's long and unwavering commitment to the principles of the Free National Movement and his dedication to his constituents, all of Grand Bahama, and to the Bahamian people as he serves out the remainder of his term in office. As for why he decided to make his announcement now, Grant says it's time for the F&M to choose a new candidate for the Central Grand Bahama seat. Reporting from F&M headquarters for our news, I'm Jasmine Brown.
Thanks, Jasmine. Well, on the heels of the passage of the National Health Insurance Bill, the government has issued a request for proposal for services relating to the public insurer. Dana Smith tells us more.
The government has issued a request for proposal for the public insurer. However, there is still a lot of uncertainty surrounding that January deadline for the implementation of primary care services. Officials today said now that the NHI legislation is in place, they're going to have some frank discussions about that.
NHI reps hailed the RFP as yet another milestone in the journey towards universal health care. The RFP comes just days after Parliament passed the long-awaited NHI bill in the House of Assembly and the Senate.
So the RFP sits as a legal document inviting tenders or bidders from around the globe to take part in this process to assist the government in finding the most appropriate company that will be the managing company for the public insurer.
It is the intent of the government to create a wholly government-owned and operated, fully licensed insurance company to manage and administer the benefits under the NHI plan. A single contract will be awarded through this RFP process relating to public insurer.
But will the government be able to have a public insurer in place ahead of the proposed January implementation date for primary care? According to the RFP, proposals from bidders must be submitted by October 7th, and it is anticipated a contract will be finalized by November, with the public insurer launched by the end of 2016. Pressed on whether the public insurer will in fact be in place before January, Dillett noted the NHI Act will give the Secretariat an opportunity to strategize as it relates to timelines.
At this particular juncture, we're waiting for the NHI bill to officially become an NHI Act so that we can meet with our policymakers and make those critical decisions and advise the public right away. You would know that before now we had absolutely no authority. NHI did not exist on the books. Now that we have that legislative power, we're able to make the critical decisions that are necessary.
Reporting for our news, I'm Dana Smith.
Thanks, Dana. Well, scores of former Sandals employees, many of whom have worked at the resort for over a decade, attended Sandals Job Fair today in the hopes of being rehired. Though government officials have called the job fair suspicious, some workers blamed the union representing them for the resort's temporary closure. Giorgio Sturrup has that story.
That's right, Christina. Exactly 1 week after receiving their final checks from the Sandals Royal Bahamian Resort, former employees were invited here to Christ the King Church in Ridgeland Park to reapply for those former positions. It wasn't a heavy turnout, but those employees we spoke to say they're optimistic about their chances. Trade Union Congress President Obie Ferguson called the job fair an insult to employees. However, some workers blamed the Bahamas Hotel Maintenance Union for the resort's temporary closure and subsequent job losses. Autherine Rose, who worked at the resort for 14 years, says she does not support the union, and with 3 small children to feed, she needs her job back.
It is what it is. It's not my hotel, and I only could go by the laws they put in. So I'm here, I reapply, and I feel positive about it.
Were you a part of the union?
Not really.
Not really?
No.
No. Okay.
I don't support the union.
Okay.
It was a bad feeling, but today it felt much different. And I have positive idea that I probably will be coming back to Sandals. If not, like she say, move on and look for something else to do.
LaToysa Walks says she's excited to reapply, and she hopes to be rehired because she has 2 young sons to take care of.
I feel like I'm one of the best employees. I'm going to give it a shot again. I'm going to go at it and do my best.
This November would have made 19 years that Arizona Roll was working at the resort as a dining room supervisor.
I must say the process was quite simple to me. It's a normal process where you fill out an application form, and they do have you doing an examination. The examination is quite simple. It's general questions.
Iva Mae Clark, who worked at the hotel for 20 years as a laundry supervisor, said she was upset last week like everyone else when she found out about the news, but says she now understands why it had to be done.
I feel good. They have a job to do, so you just have to comply with the job.
Some employees have expressed that they feel kind of betrayed by the company after working for so long. Do you feel that way?
No, I don't feel that way.
Reporting for our news, I'm Giorgio Sturrup.
Thanks, Giorgio. Still to come on our news, the Trade Union Congress gives its take on the Sandals Job Fair, how government is working to secure a fund for catastrophic health care, and the Bahamian beach soccer team makes a big move in Switzerland. That's coming up when our news returns.